Hello.
What's your name?
Joel.
Joad. I'm going to examine your abdominal system today
Okay.
and for signs of abdominal disease. Is that okay?
Okay.
Do you have any pain?
No.
No. Okay, thank you very much. I will start by looking at your hands. So if you can put your hands out for me. Thank you. So I'm looking in the hands for leukonychia, white parts in the nails, or koilonychia, spoon-shaped nails. I'm also looking for clubbing, and I can ask the patient to put his fingers together and see that there's air between them. If you turn your hands over for me, I would also be looking for palmar erythema, redness in the palms. And I can also look in the hands and up the arms for purpura, the reddish purple marks. Okay, so if you can put your arms out like this for me, I'm looking for a liver flap. So if the hands move like this, there is signs of liver disease. And if you rest your arms down, I'm just going to feel for the pulse. So I'll time the pulse and also watch for respiration for respiratory rate at the same time. I will then move up the arms looking if there's any signs of needle tracks on the veins, and I would also measure the blood pressure. I can also see if there's any tattoos that the patient may have. Then I move up to the face and I will look for anemia. So may I just pull down the corner of your eye? Again, looking for pallor, for anemia. Also in the eyes, we can look for yellow colour, for jaundice. And in the mouth, we can look again for signs of anemia, for angular stomatitis. And if you open your mouth for me, thank you, close it, and glossitis, any ulcers in the mouth. Then I'll move down onto the chest and the neck. We want to feel for lymphadenopathy and feel especially in the left supraclavicular fossa here for Virchow's node. We then want to inspect the chest and abdomen. We're looking for any signs of gynecomastia, for any spider nevi. We'll also be looking for Gray Turner's sign, which is bruising at the sides, or Cullen's sign, which is bruising around the umbilicus. We can look for any swellings, any scars, or any stomas. Okay, so we've inspected both the chest and the abdomen, and we lie the patient down, and again you can look if there's any swelling, if there's any deformity, if there's any stomas, scars, anything like that on the abdomen. After inspection, we want to feel, so palpate. Now we want to watch the patient's face if they have any pain. We want to feel in 9 areas. To begin with, we feel lightly, so we're pressing lightly in each area. And then we want to feel again more deeply, so you want to press in deeper. And again, watching the patient to see if there's any pain. Is that okay? No pain. Obviously, if you feel a mass or feel something, you want to feel around it to feel the size, the shape, the consistency. Once we've felt all 9 areas, we then want to feel for the different organs. So we want to feel for the liver. Can you breathe in and out? And again, in and out. And again, in and out. And once more, in and out. Thank you. And again, starting in the right iliac fossa for the spleen, we want to feel across. And again, breathe in and out, and in and out. And I can roll the patient slightly towards me to press to see if I can feel the spleen edge. Then for the kidneys, I want to press with my hand behind and feel on the top to see, can I feel the kidney moving, which normally you won't feel. You can press to feel for the abdominal aorta. If it's pulsing and expanding, it could be a sign of aneurysm. After palpating, we want to percuss. We can percuss the edge of the liver going up, or also coming down to feel, to heal for when it's done. We also can percuss if there's fluid for ascites. So you want to percuss to the side. When it becomes dull, you roll the patient. So can you move that way? Okay. And then you percuss again it should become resonant. And roll back. You can also test with for a fluid thrill. If you put your hand in the middle like this, you want to press on one side and flick with the other. So if I flick here, I'm feeling, is the impulse going through the fluid? Thank you. So we've inspected the abdomen, we've palpated, we've percussed, and then we want to auscultate, listen for bowel sounds in 4 areas. So I'll get my stethoscope. And you want to listen for 2 minutes for there to be absent bowel sounds, but usually you can hear bowel sounds before that. You can also listen for what's called a bruit for the renal arteries either side. So then I will complete the examination by inspecting for edema, by inspecting the hernial orifices, performing a digital rectal examination, by looking at abdominal x-rays and testing the urine and measuring the temperature. And I'd finish, of course, by thanking the patient.